Okay, so I'm going to check the EMR for the orders. This patient has an order for morphine at 4 milligrams through their IV. So I'm going to get my flush to check for the patency and make sure the medication's all the way in. And then I have my other fluid that I'm going to be mixing the morphine in with. And this bottle here is at 5 milligrams per milliliter. The order is for 4 milligrams, so I did the math. And it comes out to, I need to withdraw 0.8 milliliters of morphine. So I have my needle. I'm going to pull in some air to 0.8 milliliters, stick it in, tip it upside down, push in the air, then withdraw the medication to 0.8 milliliters. And then I will stick the needle into this, and then I will push the morphine into here. Alright, so my flush and medication are now ready. So now we need to go get my PPE on. Alright, so put the medication there. Start with this one. Put that over. And then tie it in the back. We'll get my gloves right here. Make sure to go over the sleeves of my gown. This patient is on contact precautions, so this is why I'm putting on my gloves and my gown here. Alright, so now we can go into our patient. Come in. Hi, my name's Joy. I'm going to be your nurse today. Can you give me your name and date of birth? Julius P. Patches, date of birth 2/17/1920. Alright. Well, Mr. Julius, I hear you're at an 8 out of 10 pain level. Are you still at that? You are? Okay. Well, I have some morphine here for you. It's for your pain. It'll help take it away or at least make it less. With this medication, you have to be careful when sitting up and standing because it can make you lightheaded and dizzy. So after we give this to you, just if you get up to go to the bathroom, just be slow about it and take your time. It can constipate you, so I'll make sure that there's stool softeners for you to take later too, to take care of that. Do you have any allergies that you know of? No? Okay, good. I'm going to check the IV site for infiltration, redness, swelling, infection. It looks good to me. So we're going to get started on this. So I have my flush. Oh, hold on. I have my alcohol pad. I'm going to clean the alcohol site here. Throw that away, and then we will flush to make sure it's patent. So I'm going to do this. Flush about 5 milliliters. It goes in really easy. So it's the IV site's patent. Now we're going to add the morphine. Now as I'm doing this, tell me if you feel weird or burning of any kind, okay? So I'm going to start flushing this in, and we're going to do this over a period of 5 minutes. Alright, so bear with me. We've got about 5 minutes to get this medication in. And then 5 minutes is up. Take that off. Now we're going to flush the rest of this in to make sure all the medication actually goes into our patient here. So we'll flush the rest, this saline in. Alright, and it went in really well. Okay, throw this in the sharks. Make sure it went in. And then I will lower the patient's bed to a safe level, get them the call light. Sir, is there anything else that I can do for you? No, you're okay? All right, well, I'm going to come in and check on you in a few minutes to see if the medication has helped your pain level at all and make sure that you're doing okay. All right? Okay, so I'll come here, and before I leave the room, I will take off my PPE. I will hold it away from me and only touch the inside of the gown while I'm taking it off. So, throw that away. Then I will go wash my hands and I will document. I will document that the person tolerated it well so far and that I'll be back in to reassess in a few minutes. And that's it.